Raise your hand, were there any interesting insights that we want to share? I'm seeing this group up front and then back there. Okay, great.
Hello. So I think one of the things our group all collectively agree on is we would like updates. Even if the updates are, we're still collecting data, we're still collecting participants. Because I know, at least for the study that I was in, it was 2 years ago. And this is the first time that we've been updated since then. So I think that's really important because it goes back to what Dr. Bailey was saying, and then, you know, all the researchers on campus are really excited to recruit us, and we're happy to participate, and we have that excitement too. But if you want to build trust with those that you're recruiting, you really need to report that back to us.
Thank you. Yeah, my group said that too, was even if the study was unconclusive, could we just get a thank you so much, we're going to go in a different direction. Yeah. I think, did this group up front have something? Okay.
Show of hands.
Okay, thanks. Similar feedback here. Anyone else have other kind of insights or, yeah, please.
There was one suggestion posed.
That there would be an app.
An app.
Yes,
An app. So we would
have some input from you, a rep from the organization about where our data has been used or not, and if it's been significant to whatever research project there is, and some kind of seconding exactly what others are saying.
Okay, thank you. So maybe a little bit more regular communication. Okay, thanks.
So ours was also similar to communication, starting something like precision communication where you pretty much help people who don't speak English as well, or people who are not, you know, born here, and how to translate that information in a better way. There's other like pilot programs that you could do, like we're talking about people who have like recorded therapy movements for patients to look at since they can't communicate. So yeah.
That's great. Thank you. Appreciate it. I think, was there one more question? Let's make this our final one, and then again, we're gonna get you out of here on time, but I appreciate the dialogue. And I'm going to put a little plug in for evaluations again, if you don't mind.
So ours was all about the same. I think we're all in agreement. More communication, definitely get those report outs. But one thing we kind of talked about was like that a lot of us have signed up through like a portal for research participation, and we plug in all this data and everything. But we've found collectively that it's not maybe the best tool, user interface, but probably needs a facelift, probably needs better algorithms. So that would be our biggest suggestion.
Thank you. Appreciate it. Thanks so much. Well, we hope that this is the first of many opportunities to connect if you haven't connected with us before. So I'm going to welcome Dr. Hayek up to finish us out here. Thank you.
Thank you, Erica. Thank you, everybody. I mean, while we've talked about how research can advance care, we've talked about the importance of diversity in research with far-reaching consequences, as we've learned with the pulse oximetry study. Dr. Bailey and others, you've talked about advocacy in research and how participants such as yourself can really help in establishing trust. A lot of the tables, and especially in that last piece, really discussed about challenges facing research and participation and how we can help overcome these challenges. Who found this useful? You gotta take a picture of this. You know, it's sad to think that this was the first such event. I mean, your input has been crucial. And if you ask any researcher before this event, what's the most important element of research, everybody will respond is it's the participant. But is that something you felt before? No. I'll tell you what I think. I agree, and I think that we need to remind participants how important their role is in everything that we do. And this is really just the beginning. This is really us trying to understand how we can do this better, how we can do research better. And so we are extremely, extremely grateful for your time. We are all taking notes here. We're really paying attention to everything that's been said and thinking about how we're going to implement this better. And I assure you, this is just the first of many events, many ways that we are going to communicate with you and hopefully receive more feedback as to how we're going to do this better. So really, thank you, thank you, thank you. Before I let you all go, I just really want to thank Erica, like I was really orchestrated this interview plans to act with as well as like the leadership, office of the president, vice president, etc. But really, it's Erica, the Precision Health, and yourself. So thank you for your time today. We appreciate you.